Hello, welcome. My name is Christian Romero. I'm going to be your provider for today. Before we begin, we're going to be recording this video for YouTube and academic purposes. I would need your consent before we start. Do you agree?
I consent for this video to be used as educational purposes on YouTube.
Okay. Can you tell me your full name and date of birth?
Tanya Romero, 11/15/82.
Okay. So first, we will be checking the patient's blood pressure. So in two positions, when the patient is sitting down and also standing up. Since we're not going to be using or checking the actual blood pressure, I'm just going to be simulating. I'm going to be checking the blood pressure on both arms. The reason why is because we want to see if there's a change in blood pressure in one of the arms. Might be indicative of peripheral vascular disease. Now we're going to be beginning with the actual assessment. So if I can have you lay down over here. So I'm going to be checking for a JVP. I need to have the patient in a 30 to 45 degree angle. I'm going to have my patient move to the left side. Guess this. So I'm checking for the notch and also where I can see the actual pulse vibrating. So now I can see it over here. So I'm gonna have this and then measure it from where the end of the vibration or the pulse and then the notch. So it's about 2.8 centimeters, which is normal. I'm also gonna have, I'm gonna check my patient's carotids. Just including one of the carotids. I don't wanna impede blood flow going to the brain. So first I'm gonna be checking for the first carotid over here. So I'm checking for the intensity of the pulse. In this case it's +2. The rate is regular rhythm. And then there's no vibration or any trills, which is normal. I'm gonna have you face this way. So I'm gonna do the same thing on the opposite side. So same thing, I'm checking for the intensity, it's also +2, regular rhythm, and +2. Okay. I'm gonna have you sit down at the edge of the sofa, please. So I'm inspecting my patient's chest, the sternum, for any deformities, I'm checking for symmetry. So I'm also gonna be palpating for any trills. Okay. I'm gonna be beginning to do the auscultation part. So I'm gonna be doing the carotid and also the chest. So I can feel the notch. So this is gonna be the second intercostal space to the right, which is the aortic valve, and then the notch over here. So second intercostal to the left, that's gonna be my pulmonic. So third, that's gonna be my Earth's point, and then fourth, the tricuspid, and then the fifth over here, that's gonna be my mitral or the bicuspid valve. So I'm gonna be using my diaphragm for all areas, and also I'm gonna do, once I do it with the diaphragm, I'm gonna use it with a bell, and also I'm gonna be checking the carotid. So I'm gonna be auscultating. So I'm going to use the same process, but now using the bell. And when I'm auscultating, I'm checking for any bruits. In this case, the patient doesn't have any, which is normal. So I was listening to all the areas, and there's a regular rhythm. S1 and S2, it's regular. There's no S3 or S4, which in that case will be abnormal. Carotid, like I said, is +2. I'm gonna have my patient be sitting, laying down again. So you can lay down. So I'm checking for the pulsations of the apical, and also for any precardial pulsations. So I can't see any. I'm gonna have my patient lay to the left side. So I'm gonna be checking for point of maximal density or intensity or PMI. Okay, now we can feel it, which is also normal. So if you can lay facing up. Now I'm going to be checking the patient's abdomen. I'm going to be palpating, checking for the aorta, abdominal aorta. So I can't feel it, which is also normal. And I'm going to be auscultating. So it's also a regular rhythm, +2. And before I'm gonna be checking the extremities, I'm gonna be having my patients sit down again. So I'm gonna be checking the S2, the S2 splitting. So I'm gonna have you take a deep breath when I put my stethoscope on top. And then I'm gonna see if there's any splitting on the S2. Maintain your inspector. Breathe normally. So there's splitting on S2, which is also a normal sign. So then I'm gonna be proceeding with checking my patient's peripherals. So I'll be checking her skin, inspecting her skin. So the nails, there's no clubbing, no cyanosis. Capillary fills is less than 3 seconds. When I'm touching the skin is warm, which is a normal sign also. So same thing, checking for capillary fills, no clubbing, no cyanosis. Now I'm going to be checking the radial pulses. So +2 on the radial arteries. I'm going to be checking the brachial. Also +2 on the left. So I'm going to be palpating on the other arm on the right. It's also a 2. Okay. Now that I did the radial and the brachial, I'm going to be proceeding with the lower extremities, and then I'm going to have my patient lay down again, which I'm going to check the femoral pulses. So same thing with the lower extremities. I'm going to be checking for the dorsal pedis pulse. It's also a +2. My other leg over here. You feel comfortable? Mm-hmm. So +2. I'm checking for capillary fills on the toes. So capillary fills less than 3 seconds. There's no cyanosis, no clubbing on the nails. I'm gonna make my way up. So I would have the pulse or the leg laying downwards, but I'm gonna be checking the posterior tibialis. In this case, I'm gonna be laying the foot like this because I wanna capture the whole lower extremities for my video. So also +2 on the left posterior tibialis, and also a +2 on the right. Now I'm going to be checking the popliteal. Okay. Also a +2 on the left. And +2 on the right popliteal. I'm going to have you lay down again. In this case, I'm just going to simulate where I'm going to be exposing my patient a little bit, making her comfortable. So the femoris, it's kind of like the inguinal area right over here. I'm going to do it on top of the video, close, because I don't want to make my patient uncomfortable for the video. So pulse is +2. And then I would auscultate also. On both sides. So when I'm palpating, I'm checking for trills. When I'm auscultating, I'm checking for bruits. In this case, the patient doesn't have any. And do you have any questions?
No.
So everything is normal. If you have any chest pain, any shortness of breath, you notice any circulation problems, please come to the clinic again. Okay. Alright, so that concludes our video. Thank you.